Welcome to the Health Insurance and Pharmacy presentation for active state and local employees, a health insurance topic. By the end of this presentation, you will be able to enroll in group health insurance program coverage if eligible, choose a plan design, choose a health plan, find an in-network pharmacy near you, and find resources for more information. Let's start by diving into group health insurance program coverage by looking at who is eligible, how to enroll, finding your employer's health plan information, the monthly cost, and uniform benefits. Eligibility is slightly different between state and local employees. State employees are eligible to elect the medical coverage of their choice. However, local employees are eligible for the program that their employer offers. Both state and local employees may enroll during the open enrollment period or a life-changing event such as marriage or having a child, and both should follow your employer's instructions to enroll in medical coverage. If you are a new hire, please speak with your employer for specific enrollment opportunities. If you are unsure if you are considered a state or a local employee, or what medical coverage your employer offers, speak with your employer for information about your specific program option. You may also find your health plan by going to the Benefits Available to Me page at our ETF website. Another source of information is the Health Benefits Decision Guide that your employer may have provided to you. The cost of your premium is determined by a few factors. The main factor is the plan design you choose. For locals, your plan design is limited to the one your employer has chosen. For both state and local employees, monthly costs are affected by the type of coverage you choose. That's individual or family coverage. All group health insurance programs have uniform benefits. This means there's a standard set of covered procedures and services available to all group health insurance program members, regardless of employer or plan design option. For example, emergency care, mental health services, and preventive care and immunizations are all uniform benefits. Now we'll look at how to choose a plan by looking at plan designs, how to select a health plan, and finding pharmacy information. As I mentioned earlier, the cost of your monthly premium is mainly determined by your choice of plan design. A plan design determines how much you pay per month, how much you pay when you visit a provider, whether you can see providers locally or nationwide, and if you can see providers out of network. If you are a state employee, you have the option of 4 different plan designs. The High Deductible Health Plan, or HDHP for short, offers local medical coverage in the state of Wisconsin. It also has a higher cost when visiting providers, but a lower monthly premium. A health savings account, or HSA for short, is required, and your employer contributes to your HSA to help offset some of those visit costs. The IYC Health Plan also offers local medical coverage in the state of Wisconsin. It has a lower cost when visiting providers, but a slightly higher monthly premium than the High Deductible Health Plan design. An HSA is not available, but you may choose to enroll in the Healthcare Flexible Spending Account available to all state employees. The Access High Deductible Health Plan, or Access HDHP, offers nationwide coverage with out-of-network benefits at a higher monthly premium. Like the regular HDHP, it requires an HSA with contributions made by your employer. The Access Health Plan offers nationwide coverage with out-of-network benefits at the highest monthly premium. An HSA is not available for this plan, but you may choose to enroll in the Healthcare Flexible Spending Account available to all state employees. A quick note about those HSAs. Health savings accounts are required for high-deductible health plan participants only. To be eligible for a health savings account, you cannot have any other health coverage that pays for out-of-pocket health care expenses before you meet your HDHP deductible. For local employees, your employer determines your local health plan design. Speak with your employer to find out your specific health plan design. You will have a choice between a local health plan that includes coverage in the state of Wisconsin or Access Health Plan that includes nationwide coverage and out-of-network benefits at a higher premium. To choose or change your health plan, go to the Benefits Available to Me page by clicking Benefits, then click Benefits Available to Me. Type in a keyword from your employer's name. For example, use Trust for the Department of Employee Trust Funds or Madison for the City of Madison. Click the Health Plan card. It will start with the word state or local. Scroll down a little bit to Health and click the Employees card. Scroll down to Getting Started and click Health Plan Search. Use the filters on the left side of the search page to narrow down your results by county or state, coverage area, local or nationwide, and plan type, non-Medicare or Medicare. Click on the name of the health plan or its logo to be taken to the plan's information page. Each plan design includes a list of service areas, counties and/or states, and health systems, services, provider directory, contact information, and the plan website link. Pharmacy is a uniform benefit included with all health plans. Each covered prescription drug falls into one of the 4 cost-sharing levels. The lower the level, the less you pay. Level 1 has the lowest cost and consists of generic prescription drugs. Level 2 costs a bit more for preferred brand name drugs. Level 3 consists of non-preferred drugs. These are brand name drugs that are not included on the plan's formulary, which is their list of preferred prescription drugs. Non-preferred brand name drugs have higher coinsurance than preferred brand name drugs. And lastly, Level 4 drugs are high-cost specialty drugs that require special handling, administration, or monitoring. These drugs treat complex and chronic conditions such as rheumatoid arthritis or cancer. Go to the Navitus ETF website or log in to Navitus's website to see your health plan designs formulary. You must fill your prescriptions at an in-network pharmacy. To find a pharmacy and covered drugs for your health plan, go to the Navitus ETF website. Select your health plan design. Find an in-network pharmacy by selecting Pharmacy Search from the menu. You can also find covered drugs for your health plan by selecting Formulary from the menu. Use the Navitus website to find the exact cost of your drugs at different pharmacies. Go to Navitus.com, select Members, and log in to the member portal. Sign in with your user ID and password. If you are new to the website, select Register Now to set up an account. You will need your Navitus ID card handy, so that you can put in your member ID. Once you are logged in, select Drug from the top menu and select Find a Drug from the drop-down menu. Look to the related resources on the right side of the page to find a PDF of the presentation slides used in this video. You will also find links to pages and other resources you may find helpful. Stay connected to ETF. Get up-to-date information about your WRS benefits by subscribing to ETF email updates, talking with a benefit specialist, going to our website, or subscribing to one of our social media sites.